If you have been an avid reader of my material, then you know of my escapades, intriguing escapades with Viagra. I was able to tell how I was introduced to Viagra and how I used it, and also my experience with it. So today we are going to talk about Viagra. The scientific name is Sidenafil, yeah? But locally we call it the blue pill. So maybe we can begin with the history of Viagra or the Sidenafil. Basically, it was originally developed by Pfizer. I think you have heard of Pfizer, especially during COVID-19. Whereby Pfizer was able to develop, I don't know, vaccines, yeah. Pfizer developed it in the late 1980s as a treatment for high blood pressure, what we also call as hypertension, and also angina. So there's also a condition called angina. So during clinical trials, the researchers noticed an unexpected side effects whereby men were experiencing improved erection. So this was by mistake, yeah. And in 1998, the FDA, that's the Food and Drug Administration of the USA, approved Viagra as the first oral treatment for ED, that is erectile dysfunction. And it was a breakthrough moment in the pharmaceutical history. So how then does it work? So the mechanism of action for Viagra is that Viagra belongs to the class of drugs known as PDE5 inhibitors. So it works by relaxing blood vessels and increasing blood flow to specific parts of the body, particularly the penis, thus facilitating an erection in response to sexual stimulation. So there has to be a sexual stimulation for you to be able to achieve that erection. And also erection has to do with blood flow. At the end of the day, it's about blood flow. Yeah. Let's talk about erectile dysfunction or ED, whereby it's a condition where men struggle to get or maintain an erection. It's a common problem among men. It's only that most men can't say it. Maybe if our women were to come out and say about the problems men are going through, then you'll know that this happens to majority of men, yeah. So let's say Viagra only works in the presence of sexual arousal. So we have to know that, yeah. So meaning it doesn't work, or rather cause spontaneous erection. So if you are not stimulated sexually, even if you take it, you are not going to get an erection, yeah. So it's not used to treat erectile dysfunction. So basically that's what we are saying, yeah. But then in the presence of sexual erection, it can be able to help you achieve a good erection, yeah. So number 3, medical uses beyond erectile dysfunction. So it's also used in pulmonary arterial hypertension, PAH, whereby Sidenafil is also prescribed under the name of Revatio for treating PAH, a condition where high blood pressure affects arteries in the lungs. And also we have off-label uses whereby there are ongoing studies and uses of Viagra for conditions like altitude sickness, Raynaud's phenomenon, and even heart health due to its effects on blood circulation. And it's also good to talk about the side effects of Viagra, whereby these side effects include, and I'm very familiar with this, whereby you have headaches. So you are like, you know, I think there's this comedian who explained it better. I think I'll find the clip and send it to you, yeah.
Too good. It make your dick hard as a rock and make your head hurt at the same time. You are delivering pleasure and receiving pain. You just
So there are headaches, flushing, upset stomach, and nasal congestion, yeah, whereby you can't be able to breathe, you are congested in your nostril. But then there are serious, very serious side effects, and these include priapism, whereby an erection can last more than 4 hours. I know you want an erection, but then you don't want that kind of a lasting erection. Yeah? And then the sudden vision or hearing loss, and cardiovascular issues in those with pre-existing heart conditions. And I think you have had cases whereby people even die from using sildenafil, especially when they have heart problems, or because this drug makes your heart pump blood like crazy, so the blood pressure can actually go super high, and if you have issues with the heart, then that will send you to your maker very quickly. So it's also good to talk about the contraindications, whereby men taking nitrates for heart problems or even alpha blockers that is, for blood pressure should avoid Viagra, as it can lead to dangerous drop in blood pressure. So if you are taking medicine that, or maybe if you have a cardiovascular issue, kindly stay away from Viagra. That's what we are saying, and we can't preach this enough. If you have a heart disease or cardiovascular disease, stay away from Viagra. It's going to kill you or even cause more problems. Yeah. So what are the myths and misconceptions surrounding Viagra? So number one is Viagra is an aphrodisiac, meaning that people think Viagra increases your libido. The truth is, Viagra does not increase libido or sexual desire. It simply helps maintain an erection when sexual arousal occurs. And there's a lot of misuse, especially in younger men. So some younger men misuse Viagra thinking it will enhance sexual performance. So as we have said, there are so many potential dangers of using it recreationally. So it's not a drug that you should use for recreational purpose. So if you can be able to avoid it, please do. There's a lot to talk about it, but then I was trying to give you the best information, the most important information. So I think you have now known the history and what it's used for, and we have clarified the misconceptions and also how it works, basically. And I think that's the most important bits that you need to know about Sidenafil. If you have any questions surrounding that, shoot it. Cheers.